Every pet owner has been in this situation. You're sitting in the vet's office and the doctor asks, when did this start? Has this happened before or has anything changed recently? And you freeze because you've been tracking your pet's health only in your head or in a note you saved somewhere and you can't find. For 70 million pet owning households, there is no good way to track a pet's health over time. There are apps to book vet appointments, reminders for vaccines, but nothing that actually understands your pet's health story, nothing that can look at months of observations and say, this is a pattern, and your vet needs to know about this. So that's the problem PawLog solves. We could have built a simple logging app, but logging isn't the hard part. Making sense of what you have logged is. This is where agents change everything. A single AI model can answer a question, but a team of specialized agents can do something much more powerful. They can collaborate, each one focusing on a different piece of the problem. When you log an observation in PawLog, it doesn't just sit in a database. It triggers a coordinated pipeline of agents, each one handing off to the next, transforming raw free text into structured medical intelligence. PawLog's agent pipeline runs on Google's ADK. A pet owner submits a log through our front end. That request hits our back end, which kicks off an async agent job store in Supabase. The intake agent passes the free text entry, extracting symptoms, severity, and affected body parts. It passes structured data to the analysis agent, which queries the pet's full history, identifies patterns, and flags anything that's changed over time. The report agent synthesizes everything into a vet-ready summary, and our chat and vet agents round out the pipeline, one for real-time Q&A with owners, one powering the dedicated vet portal. 5 agents, one coordinated pipeline built on Google ADK powered by Gemini. So let me show you what this looks like. This is the PawLog log entry page. Bella's owners has noticed she's been scratching her ear and skipping meals. They write it out in plain English, no forms, no drop-downs, no medical terminology required. Just describe what you saw. Then hit save log and the agent pipeline starts automatically. In the background, you can see the agents working. The intake agent has already extracted the key observations: ear scratching, reduced appetite, afternoon lethargy. The analysis agent has found a pattern. This is the third time ear scratching has appeared in 30 days. And the report agents will generate the summary. This is the output, the vet visit summary. Primary concerns organized by severity, a 30-day timeline, and suggested questions to bring to the appointment. So you walk into the vet's office fully prepared. No more saying, I think it started maybe 2 weeks ago, I'm not sure. On the other side, vets get their dedicated portal. A pet owner shares access via a secure invite link. The vet sees the full health history, can leave clinically verified notes that sync back to the owner's app, and receives the AI-generated summary before the appointment. So both sides, owner and vet, working from the same picture. PawLog is built on Google ADK for agent orchestration with Gemini 2.5 Lite as the underlying model. The front end is Next.js on Vercel. The back end is FastAPI on Randall, with Supabase handling Auth and data storage behind row-level security policies. Beyond the AI pipeline, PawLog ships a complete feature set: dark mode, QR codes for emergency access, CSV export, co-owner sharing, lab result uploads, and shareable read-only links for vets. Pets can't tell us when something's wrong. PawLog makes sure nothing gets missed. Give every pet owner the tools to notice, track, and communicate so that when something is wrong, their vet has everything they need to help. Thank you.